evening, respected dignitaries on and after dais. First, at outside, I would like to congratulate Ayush team for conducting a wonderful World Ayurveda Congress and Arogya Expo. In continuation with the focal theme of Ayurveda for all, let me realize you little facts that are occurring in the present condition. See, if you see the global deaths, there are 35 to 40% are cardiovascular deaths, and the main cause is revealed as coronary artery diseases. And these coronary artery diseases are 40% in statistics associated with hyperlipidemia, which shows the prevalence of hyperlipidemia. But this particular hyperlipidemia can be correlated very well with our classics, that is Medho Pradoshija Vikara, by almost all acharyas. And when you see the Saulya Samprapti in particular, you can see that the abnormal Medha Dhatu is in Deha Sanchari, which is formed because of Dhatu Dvayam Atikramya. That is, the Rasa Dhatu, instead of completely manifesting into Rakta and Mamsa, there is sudden transformation into Medha Dhatu, and this Medha, which is in Deha Sanchari, can be correlated with the increased circulated lipids, that is hyperlipidemia. And the chikitsa for this is mainly Agnivardhaka, Avaranahara, Lekhana and Rukshana, and the modalities can be applied in these ways. And mainly the Sushruta has highlighted one particular Gana, that is Ushikadi Gana, for the treatment of Medahara, that is like Ushaka, Shilajatu, Tutta, Kasisa, Hingu and Avakshara. And this particular reference made us to reduce the mortality through Ayurvedic approach. My study has started with the Ushikadi Lekhana Basti in hyperlipidemia. And the objective is to evaluate the efficacy of this particular Basti, and it is diagnosed the patients with elevated lipid profile, BMI greater than 25, and here inclusion criteria is with hyperlipidemia with and without obesity, and those who are arhas of Basti, and exclusion criteria is with suffering from these systemic disorders and rectal pathologies. And the yoga for the Ushikadi Lekhana Basti is as follows, that is Makshikam, Lavanam, Sneham, Kalkam, Kvatamiti Kramat, and here Kvata is Trifaladi Kvata, and as Prativapa Dravyas, the main Dravyas which precipitate the action of this particular Basti are Ushikadi Gana, that is Ushaka, Shilajatu, Tutta, Kasisa, etc. And the study design is designed into 3 groups, that is one group with hyperlipidemia with obesity, and without obesity is the second group, where both the groups have been given Anuvasan Basti with Murchita Telataila and Niruha Basti with Ushikadi Gana Lekhana Basti, and third group is positive control group, where the patients are subjected with atrovastin. And the main drug here, Ushaka, there is a slight confusion regarding this Ushaka drug, but here we have taken the real Ushaka, that is a mineral drug, and it is nothing but Ksharam Rutika, and the preparation is very clearly narrated on the slide. So this is not here Shilajatu or any herbal drug, it is a separate Ushara Kshara which is collected from different areas, and the most alkaline drug has been selected for this study. And we can see the very encouraging results. I request all the audience to pay little attention here. See, when the total cholesterol levels, when you compare, the average mean difference is about 30 milligrams in the experimental groups like group 1 and group 2, where the patients have taken this Ushikadi Lekhana Basti, and when the patients who are subjected for atrovastin and allopathic drug, the average mean difference is about 10 milligrams. And the same changes have found even in the case of triglycerides. And the most impressive thing here is the HDL levels are increased in the case of the Ayurvedic groups, whereas in the case of allopathic group, the HDL levels are reduced. And LDL and VLDL has also shown very good encouraging results, and almost all the results are significant statistically with P less than 0.05. And we have one more group that is associated with obesity. So here we have found that who are obese patients, average reduction of 3 kilos weight has been found in one group, and those who are non-obese, just only suffering with hyperlipidemia, there was no much weight reduction. Means this Basti has weight reduction only in obese people, but in non-obese people it has reduced only lipid levels but not weight. And coming to the particular which parameter has reduced, means here we can see Udara and even Spic as the main parameters which they have reduced, with a circumference of 3 to 4 centimeters for Udara and 3 to 5 centimeters in the case of Spic circumferences. So these are the differences that we have found, and in the positive group there is no absolute weight reduction. And as the results are encouraging, it has made us to think little about the mode of the action of this particular Basti. And if you see the Rasa Panchaka of these individual drugs, almost all the drugs are Ushnaguna and Ushnavirya and having Lekhana and Karshana properties. And if you concise it into a holistic principles, you can compare, there are exactly opposite principles of the Medha Dhatu, and this combined effect has made us to formulate some hypothesis which can be narrated in this following schematic representation. See, as all of us know, Basti Dravyas, they get more absorbed from the Guda because already rectum is a place where you have abundant pool of vascular supply. And here it mainly enters into Siras and Rasayanis, and they where actually Rasa and Rakta is flowing through this Siras and Rasayanis. And in this particular Rakta only we have this abnormal Medha that is circulating in the blood level. So here we can think this in the action of both Asthayi Dhatu and Sthayi Medha Dhatu. That is Asthayi, that is Posha Medha Dhatu, which is abnormal in the blood. So the principles of the drugs like Tejo Guna, Ushnavirya and Tikshna Guna made the Ksharana, Lekhana and Chedana and Kshapana of the Medha in the blood. That is nothing but it has reduced the density of the blood, and finally the lipids has totally reduced in the blood level. And when this particular level is arrested, automatically the Avarana is relieved and the Agni is corrected. And to conclude of my study, it is found that Ushikadi Lekhana Basti groups are effective, and hyperlipidemia without obesity group has responded well, and among lipids, all lipids have reduced drastically. Among that, and again total cholesterol and triglyceride shown much beneficial results, and HDL has been increased enormously when compared to the allopathic group, and prominent weight reduction is seen in the obesity patients, and especially in the case of Udara and SPIC parameters, and latent follow-up. In some patients we ask them to follow even after Dvaya Parimana Kala, that is after twice of the duration of the Basti course. So we have found there are further reduction of the lipid levels in that patients, and finally we can say it is a cost-effective and safe effective treatment when compared to atrovastine. And further scope for this study is, this is done only in the case of patients who are suffering exclusively with hyperlipidemia. But most of the patients are associated with complex pathologies like association with diabetes. So even we should know what is the action in that particular complex pathologies. And there are many researches done in the case of oral administration of this Shilajatu, Kasisa, all those drugs. So we need to compare the oral administration and rectal administration, and which is more beneficial for the patients. And there is a need to understand the bioavailability of the drug, and further it should be done on a large sample. And final scope is, as we are seeing, once the atherosclerosis is reduced, automatically the coronary artery blocks, maybe we have the chance to rectify the coronary artery blocks. So further, if anyone is interested, we can continue the study in this scope of area. Thank you.